I know. Okay. Good morning and welcome back to the KCCMH Connection podcast. Today we are here with the CEO of the hospital, Bryan Bogle. Thank you for joining me today.
Thank you, Eileen.
Okay, so we're going to dive into some pretty great questions right here off the bat. But first, can you tell us a little bit about who you are, where you came from, how you ended up in healthcare leadership?
Wow. Yeah, it's been a journey. Grew up in Southwest Louisiana, so people say I have an accent. I really don't believe that.
It's true.
No, I don't think so. And in high school, I wanted to be a petroleum engineer when I grew up, and worked offshore in the summers when I was in college. And I quickly realized that engineering wasn't for me, and went into business, went into accounting, and got my undergraduate in accounting from McNeese State, master's in accounting from LSU, go Tigers, and then just started the journey. Worked in public accounting for a few years, got into healthcare in 1993, and worked for not-for-profits, for-profits, moved around the country, North Carolina, Mississippi, Texas, Louisiana, now Colorado. Moved to Colorado in 19, been here since 2021. It's been a great journey. I tell people all the time that being a hospital CEO is the best job in the world. I get to impact lives every day, get to interact with staff, see what they do, learn what they do, learn about them personally. It's an amazing job.
So since you've been in hospital finance forever, it sounds like, have you seen a million changes?
Absolutely. We go through these cycles in healthcare. Just great scrutiny by the government, cut downs in reimbursement, reductions in covered lives for Medicaid, those kind of things. It happens on a fairly routine basis. And what we do as operators is just lean into what makes us successful. We lean into working with the staff. We lean into engaging the community, improving staff engagement. That's been a heck of a journey for us. In 2021, our staff engagement was 41%.
What does that mean, our staff engagement?
41% of our employees were happy working here.
Dang.
That's horrible. We recently completed another engagement survey. We do those pretty much every year. We're up to 78%. So it's tremendous improvement. And it shows in what the community has done and how they've reacted.
Do you know what the national benchmark is?
The national benchmark, healthcare as an industry, is in the 65 to 68%. So we're better than average, but I want to be top quartile. I want to be in that top 25%.
Yeah.
I don't want to be just good. I want to be great. So
what are you doing some things then to improve engagement here?
Consistency, engaging the staff each and every day, walking the halls and talking with them. In addition to that, we've been real purposeful in our compensation, making sure that we stay at market. That was something that was lacking back 4 or 5 years ago. Staff hadn't had merit increases in years.
And do you think that's maybe because the hospital's in a better financial situation that they can pay better?
Yeah, that's part of it. The first couple of years, it was an investment. We knew we needed to do it. A lot of out-migration of staff. They were leaving us left and right. So it was an investment that's now paying those returns.
Oh, that's awesome.
Yeah.
Let's see. So for those that fully don't understand your role, did I already ask that?
No.
Oh. What does a typical day of a CEO look like?
Typical day, there's a lot of meetings, but I try to weave into that busy day, getting out in the facility a couple of times at least, and chatting with the staff, patients, visitors, providers. It's been a big thing for us, is engaging our providers, whether they're the physicians and nurse practitioners in the clinic or whether they're the hospital-based providers that we depend on each and every day. So it's just a busy day of meetings, a lot of senior leadership type discussions, reviewing contracts. I'm just trying to think of what I've done already this morning. But you never know. You think you may have a fairly easy, kind of low impact day, and next thing you know, you're getting jammed up with some crisis.
Yeah.
But as I said, it's an amazing job.
That's cool. So what makes Kit Carson County Memorial Hospital special compared to other hospitals?
Well, for me, this is the first critical access hospital that I've ever been involved with.
So can we pause right there? Can you tell our listeners what a critical access hospital is?
Yes, I'm glad you asked. Critical access is a designation that was created back in the late 90s by the Center for Medicare Services, CMS. And what they did was realize that there are certain facilities in the country that are critical for people in those geographic areas to obtain health care. So critical access. I think there's 7 different criteria that you have to meet to be considered critical access. You have to be at least 35 miles from the closest hospital. You have to have a length of stay of less than 96 hours. There are different things you have to do. Be less than 25 beds. And what that designation provides is an opportunity to be reimbursed by the Medicare system for your costs. Significantly different than our urban, the metro facilities. Definitely very different than anything I've ever been a part of. I thought, what can it be? It can't be that much different. I'm now almost 5 years into this, and it's still a change of mindset that I developed, I guess, over the previous 28 years. But absolutely critical, again, critical access, that we get that increased reimbursement, because that's what allows us to be here. If we were receiving reimbursement like most urban type facilities, I don't think we'd still be here.
So critical access is basically a rural hospital that's far away from metro area that has a low number of beds.
Correct.
Okay. So then tell us what makes us special.
Well, again, my first critical access, so that's special to me, and just learning. It gets, this late in my career, and I'm still learning every day. Love rural communities. Before I came to Colorado, I was in a rural community in Louisiana. We have 6,000 people in the town, so about twice the size of Burlington. The parish in Louisiana was about twice the size of this county in the population. Definitely much smaller than anything I've ever been in. But the mindset of rural people is pretty consistent, right? They don't want much government in their lives. They want to be self-sufficient. They work hard. They enjoy the fact that we are 2.5 hours from Denver. I distinctly remember my interview with the board back in the spring of 21, and I made the comment about how far we are from Denver. And John Swick, one of the board members back then, made the comment. He looked at me and says, "We are not far enough." And I was a little off-put by it when he said it, and now I fully appreciate it. So it's a special place. I had a conversation with a provider who we hope to get on board here soon, and a new specialty in our specialty clinic. I was chatting with her just last week, and she was giving me the story of her journey, how she got to where she's at. And so I kind of gave her mine. And I tell you, I told her, I said, I've been doing this for over 30 years, and I'm having more fun now than I've had in my career. Great place. Love it.
Oh, that's awesome.
Yeah.
All right. So tough question is that rural healthcare comes with unique challenges. What do you see as some of the biggest ones we're facing right now? And what are you doing to address them? Or how are we as a facility addressing them?
A lot of challenges. So President Trump's big, beautiful bill that he rolled out back in the fall provides significant cuts to the Medicaid program. There's another round of funding that is happening called the Rural Health Transformation Program. And that's pumping. Colorado will receive $200 million a year that's earmarked for rural health care. Now, whether that goes to just critical access hospitals, goes to critical access plus, behavioral health and other segments of healthcare has yet to be determined. There's a community application process. So we'll go through that. But probably our biggest challenge is, quite frankly, the room we're sitting in right now, and then this part of the physical plant. Mm-hmm. We've got to plan for the future. While this building, some parts of this building has been here since 1948, we need to ensure that Kit Carson County Memorial Hospital will be here for another 60, 80 years. So looking at the physical plant, what do we do? And most importantly, how do we pay for it?
Yeah.
We've been very successful financially the last several years. Our cash balances are strong. We feel well poised for the future and can ride through just about any storm. Taking on a building project is quite daunting, and we need to make sure we're not setting the organization up for failure in the future.
So kind of to spin off there is some talk about the building changing or facility updates. Can you give us a little bit more about that?
Absolutely. We are looking at two different options. We've got, back it up a little bit. The part of the building that we're sitting in right now was built in the 70s. There's another section that was built in the 70s. Both of those are over a section that was built in the 40s. Then yet we added on to that in 2008. So we call that the new section of the building. And it's almost 20 years old. So the first option is to tear down 1940s and 1970s section and rebuild in place, add on to the 2008. The second option is to build a hospital in a greenfield somewhere. Brand new construction. What we do with this old building, I have no idea. But those are the two options that we're looking at. Very pricey options. The tear down and rebuild in place is going to would be a little bit north of $60 million to do that. And the estimate for a new building out, as they say, in a greenfield somewhere, is about $100 million. So that takes our debt service significantly up. And we have to understand what the impact of that is to the organization. We have engaged a firm to do a financial feasibility study that we're in the middle of right now that will project our future cash flow, make sure that we can cover the debt service and that we can continue to provide services for our communities.
So what will the process look like that will determine whether you build new or build on?
A lot of conversations. The board is fully engaged in this. And they're asking all the right questions. And we'll do the financial feasibility study. We'll understand what that looks like. It seems simple just to tear down old stuff and rebuild in place, but it's a long, drawn-out process. And the board is concerned that we're going to put our staff through 5 years of construction to get that done. That's just a lot of, what is the word I'm looking for, Eileen?
Just a pain.
Yeah, it would be a pain, right?
Yes.
Having to come through a construction zone every day.
Or just listening to construction might not be the best environment.
I have a feeling it would impact our employee engagement score.
I think so.
Yeah.
Yes. Okay. So will there be community input or is there more stakeholder input when the time comes?
Absolutely. We'll have community meetings. We'll chat about what we're doing and we'll fully engage the community. But I just hope they realize we need to do something. The status quo, while it can be done, they're so uncertain, right? You've got a building that was built in the 1940s. I mean, y'all do the math on that, and that was 80 years ago. But you can imagine the infrastructure and even the tie-in of the older buildings to the newer section. And there's a lot of variables that we don't know, right, until we get into what's going on in those sections of the building. So we'll definitely involve the community. We'll talk about services, what we can enhance, what we can make sure we continue, and quite frankly, what we can add.
Yeah. And kind of a big shout out to our maintenance team, because I know that they have to get so crafty when it comes to weaving those different builds together. And I just know personally that they work so hard to be creative and come up with solutions to keep this place running all the time.
Yeah. The analogy I use all the time is putting perfume on a pig. This older section is a pig, and they do a great job of maintaining it and making sure that it's a useful part of the building. So again, thank you for that. Hats off to them. They do a great job.
For sure. All right, so recruiting and retaining providers is a big topic in rural communities. How are we working to bring great people to KCCMH and keep them here?
Goes back to employee engagement. We've got an engaged staff, and providers see it. I can't tell you how many of our specialty clinic providers that come here from the city, whether that city is Denver or a couple come from Colorado Springs, and they see it, and they love coming out here. It's their favorite part of the month, whether they come 1 day, 2 days, 3 days a month. They love coming out, and so we're looking to continue to to enhance the services we provide in our specialty clinic. I had a conversation last week with a provider, not letting the cat out of the bag on that one yet, but it'd be great to add that specialty here. The one that I'm really excited right now is nephrology. We've got Dr. Brookins, who will start his clinic in the specialty clinic. He did a podcast with you here, a couple weeks ago. So he'll start his clinic on May 16th, and we'll get the outpatient. April 16th. And we'll get the outpatient side of that going. And then we're working on developing an inpatient solution for those who suffer from kidney disease. As we look at folks traveling in that interstate heading back and forth to Denver, we know that kidney disease patients make that trek a lot, and we want to keep them home. So we're going to do that.
Yeah, that's really exciting. And are we expanding cardiology as well? We
are. We are adding a new provider next month. Dr. Reddy will be coming out with Dr. Rugas. Dr. Rugas has been a mainstay of our specialty clinic for quite a long time. And Dr. Prevedel, who recently retired, they both provided an opportunity to really focus on the cardiology needs of our communities. So Dr. Reddy is going to be joining Dr. Rugas, and we're looking to expand our echocardiogram services. We're going to start some echo stress tests. So it's a fun time, and we know that our population is aging, right? And as we age, cardiology services become more and more important to the community. So we need to reflect that.
Yeah, so a couple of years ago, the hospital had to make the very difficult choice to discontinue delivering babies. And that was part of the transition, was to build services that maybe help our aging population more, or just shift what stage of life that we can be more,
right,
that we can help more.
Yep. Nope, you're absolutely right. We have limited resources, and we have to apply those resources where they can make the most impact. And unfortunately, back in 21, we did discontinue obstetrical services, but now we can reinvest, whether that's cardiology, nephrology, gastroenterology, and talking with a group to start coming out for GI. Last month, our rural health clinic sent 10 patients to the city for GI services. That doesn't sound like a lot, but you roll them all together, you annualize that, 120 patients a year. That's impactful. We need to keep them home.
That's awesome. So from your perspective, what are some of the most exciting services or improvements happening at the hospital right now?
I would go back to nephrology. That one, and we made the conscious decision that despite what may or may not, but what may be a negative financial impact of providing that service, it was up to us to provide that and keep those those folks are very sick. Kidney disease is nothing to play around with, and I think that it's going to be very impactful for the community to have that service here. So looking forward to that. We're collaborating with the area, our surrounding hospitals, whether it's in Lincoln County, Cheyenne County, and up to our north in Ray or Yuma. We want to collaborate with them and become kind of this regional hub for nephrology services. Yeah,
so that's a good point, is that a lot of times, because we're a business, people think that we're in competition with our surrounding hospitals. But is that true? Are we competing against them?
No. My counterparts in our surrounding hospitals are not our competition. Our competition are insurance companies, quite frankly.
Yeah.
No, we collaborate very well together. We're in an organization called the Eastern Plains Healthcare Consortium.
Yes.
I'm on the board of directors of that organization, and we meet frequently. I've got a meeting this afternoon to talk about collaboration and working together and supporting each other, whether that's through operations or developing programs, reaching out and getting RHTP funds to make sure that we're all stronger together in the future.
Yeah, because they might have providers that we don't have that we can refer to them. And,
absolutely.
And likewise, that we just work together to keep our rural patients rural.
Yep, absolutely. Keep them out of the city.
So how does KCCMH stay connected to our community and make sure that we're meeting local needs?
Yeah, we make every effort to be involved in the community. meet quarterly with the county commissioners, and it's a great opportunity for me to sit down, hear what's going on in their world. They can hear what's going on over here, and we can make sure we're all up to speed. We're a big sponsor of the rodeo and the fair each July. That's always a fun time. We love doing that. We love being a flag sponsor for the rodeo. We're doing the trunk or treats. We do right now we're doing the after prom type things, making sure that our kids have a great memorable time at their proms. So those are the things we do that we pitch in and help with. We give bike helmets, right, to the kids, making sure that they stay safe, and we minimize the amount of head trauma that comes through the ER from a bike accident.
So looking ahead, what are you most excited or hopeful for about the future of healthcare in our community? I'm
most excited about this building project and the opportunity to ensure that this organization will be here for decades to come. I'm excited about the new services that we're going to be providing in the very, very near future. And I'm excited about the opportunity to maintain our financial strength. Without that, things are so uncertain. I hear from peers across the state that are struggling financially at their facilities, and it's not a good world to be in. So I'm very thankful that we've been able to get there. I'm thankful for the employee engagement that we have now. Thankful for we were a top 100 critical access hospital in the country in 2025. I've never had that opportunity in my career to be a top 100 hospital, so that's great.
Yeah, very exciting.
It speaks volumes to the staff engagement, the services we provide, to the quality that we deliver. We deliver excellent quality here. We've got a great quality manager, Sarah Chacon. She is amazing in driving initiatives and ensuring that we're doing the right thing for our patients in our community.
Yeah. So you've talked about so many wonderful things. Can we talk about something not so great?
Sure.
What's the issue with billing here?
That has been an obstacle to success for sure. And the board is cognizant of that. They hear it from the community. They are the conduit of that information back to me for sure. We can blame it on information systems. We can blame it on processes. We can blame it on people. But regardless of what has caused it, we have got to fix it. Have a new chief financial officer, Kathy Wolf, started just a couple of weeks ago, and she is leaning into this. And we are going to develop procedures to ensure that the bills that go out of this place are accurate. And it was just the issues that we have had historically have been that combination of system and processes. And so we've got to optimize the system. We've got to correct the processes to ensure that we've got great communication going out to our patients. Unfortunately, that financial obligation that some of them face when they're done here, but we are going to fix it.
Yeah, and I know it's a very complicated system. And it's not easy to learn or navigate, especially when there's changes coming through all the time. But if somebody has had a billing problem here and they don't want to come back, if you could just tell them right now, what would you say?
I will apologize for the organization. I would hope that we can regain their trust, because that's what it is. You have to trust the hospital for a number of things. You have to trust them clinically, and you have to trust that they're going to be good stewards of your money. And we need to ensure that we get an accurate bill out and that our communication is accurate. And that's where we've been lacking. We'll fix it.
Awesome. Because I know we have the absolute best care around. And so we just need to finish raising the rest of our standards to that level.
Agreed.
So why should our community feel confident about choosing KCCMH for their care?
Again, back to the quality. We look at a lot of statistics. We look at a lot of quality indicators all the time. One of those would be door to CT time for a stroke patient, making sure that they get in the building, they get to the stroke, get to the CT machine. We get that interpretation performed in a timely manner. Our threshold on that one, an industry threshold, is 45 minutes from door to CT read time. And we consistently perform very, very well in that metric. There's door to EKG times for cardiac issues. There's all of these measures that we look at I'll tell you, we do an amazing job. Our outcomes are very, very good. Excited about keeping the community here, excited about growing the services, giving us an opportunity to keep more people here. I was recently looking at the out-migration data. How much of the healthcare business that occurs within this county do we keep here? Inpatient, we keep about 25% of the population that needs an inpatient stay. I wasn't surprised by that number at all, given the services that we don't provide, right? We don't crack heads, we don't crack chests. A lot of those very intense inpatient surgical, a lot of those surgical type patients that we don't keep here.
Right, because we have to send out strokes, heart attacks, long bone breaks.
Absolutely.
Internal bleeding. So if it's high level, we can't keep it here, right?
We can't keep it here, and we have some great tertiary partners in Denver that we transfer those patients to. Outpatient, honestly, I was surprised. We keep over 80% of the outpatients from this county. So just tremendous. And that's the way healthcare is going, is more toward the outpatient. I mean, it's every time you turn around, there's clinical advancement that allows us to do things outpatient. They used to be, if you had that condition, you were in the hospital for a week, 2 weeks. I mean, good grief, we're turning around open heart surgeries in 3 days out of the hospital in the city. Used to be, if you had an open heart procedure, you were in the hospital for weeks. So as we continue to move things more and more outpatient, it gives us an opportunity to be even stronger.
Excellent. All right, so final question. Even though you're now kind of a Coloradan because you've been here a while, what do you miss most about Louisiana?
The rain.
Yeah, we miss that too.
Yeah, I know. I was stopped years ago. I've got a LSU alumni sticker on my vehicle, and somebody saw it, and they were from Louisiana and struck up a conversation. And they asked me, what do you miss? And without a doubt, it's the rain. They miss fried catfish. I don't get it. But you can cook, right? And so you can replicate what you had in food from Louisiana, though it's still wonderful to go back and get that. But I can't create rain. And we live in a desert. I've got a controller that works with us, and he lives in Lafayette, Louisiana. And I think our average rainfall is like 16 inches a year. And he was joking with me very recently. He's like, dude, we got that Thursday. So I miss the rain. So when I go back, a lot of times I'll just stand outside while it's raining just to get the full effect. Yeah.
Well, bring some back with you next time.
I'll try.
Well, okay, Mr. Bogle, thank you so much for joining us today. Is there anything else you want to leave our community with before you go?
No, Eileen, it's been great. Thank you for the opportunity to visit. I hope that the community sees and appreciates the advancements that we've made in the last several years, and we're on board with us for our journey in the future.
Yes. Okay. And if you see Bogle out and about in the community, don't be afraid to go up and ask him or shake his hand, because he's very open to meeting everybody in the community and just hearing what you have to say. So again, thank you very much for joining us on the KCCMH Connection, and see you next time.